Scapular abduction and upward rotation for stratus anterior muscle. Grade 5 normal and grade 4 good. Position of patient on all grade. Short sitting on end or side table. Hands on lap position of therapist. Hand at the side of patient giving resistance on the arm just above the elbow. With the other hand, uses the rib space along the side on index finger to palpate the edge of the scapula at the inferior angle along the vertebral and axillary border. Test. Patient raises arm approximately 130 degrees of flexion with elbow extended. The examiner is reminded that the arm can be elevated up to 60 degrees without using the serratus. The scapula should upwardly rotate. Instruction to the patient: raise your arm forward over your head. Keep your elbow straight. Hold it. Don't let me push it down. For grading, grade 5 normal. For grade 5, patient reaches full ROM and can tolerate maximum resistance. For grade 4 good, patient yields against maximum resistance but manages full ROM. Grade 3 fair. Position of the therapist, same as for grade 5 and 4 test. Patient raises the arm approximately 130 degrees of flexion with elbow extended. Instruction to the patient: raise your arm forward above your head. For grading, grade 3, scapula move full ROM without winging, but cannot tolerate any form of resistance other than the weight of the arm. For grade 2, the examiner supports the patient while the other hand palpates the scapula, palpating the muscle for any form of contraction. For the test, therapist detects scapular motion with light grasp on inferior angle. Therapist must be sure not to restrict or resist motion of the scapula when it wings. Instructions to the patient: hold your arm in this position, hold it, let it relax. Grading, grade 2 poor. The scapula abducts and rotates upward as the patient attempts to hold the arm in elevated position. For grade 1 trace and grade 0, position of the patient: short sitting with arms forward flex above 90 degrees superior by the therapist. Position of the therapist: standing in front slightly to one side of the patient. Support the patient's arm at the elbow above 90 degrees. Uses the other hand to palpate the serratus with the tip of the fingers. For the test, patient attempts to hold the arm in the tested position. Instruction to the patient: try to hold your arm in the position. For grading, grade 1, you can feel contractile activity, while for 0, no contractile activity and any form of movement. Scapular depression and adduction. Trapezius lower fibers. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient: prone with arms overhead for about 145 degrees of abduction. Forearm is in mid position, thumb pointing towards the ceiling. Head may be turned either side for comfort. Position of the therapist: stand at the side, hand giving resistance over the distal humerus just above the elbow. Resistance may be given over the axillary border of the scapula. For the test, patient raises arm against maximum resistance. Instruction to the patient: raise your arm from the table as high as possible. Hold it, don't let me push it down. For the grading, grade 5 normal. Completes full ROM against maximum resistance. For grade 4 good. Complete full ROM with only moderate resistance. While for grade 3 fair, Full ROM with no manual resistance. All ROM is only partial. Grade 2 poor, 1 and 0. Position of the patient is the same 5, 4 and 3. Position of the therapist stand at test side giving support at the elbow. For the test, patient attempts to lift arm off the table. The examiner assists by lifting the arm. Instruction to the patient, try to lift your arm from the table past your ear. Grading grade 2 poor, complete full scapular range of motion without the weight of the arm. Grade 1 trace, contractile activity can be palpated from the area of the scapula, but no movement is visible. Grade 0, no contractile activity and no visible movement. Scapular elevation for trapezius upper fibers, grade 5 normal and grade 4 good. Position of the patient, short sitting on end of the table or chair. Hand relaxed on the lap. Position of the therapist, stand behind the patient, hands over the shoulder. Gives downward direction assistance. Check for scapular asymmetry for any differences in bulk and height. Patient must elevate or elevate the shoulder. Test is always performed on both sides simultaneously. Instruction to the patient. Shrug your shoulders or raise your shoulders towards the ear. Hold it, don't let me push it down. Grading, grade 5 normal. Patient reaches full ROM with maximum resistance. For grade 4 good, patients do full ROM but only for moderate resistance. Grade 3 fair. Position of the patient and therapist is the same for grade 5 and 4, except no resistance is given. Test. Patients elevates the shoulder with full ROM. Instruction to the patient. Raise your shoulder towards your ear or shrug your shoulder. Grading for grade 3 fair. Shoulder elevation with full ROM with no resistance. For grade 2 and grade 1 and grade 0. Position of the patient is prone, fully supported with the table. Head may be turned to one side for comfortable position. Therapist, stand at the side of the patient, supports the shoulder on palm of one hand. The other hand palpates the upper trapezius near the insertion above the clavicle. For the test, while therapist supports the shoulder and the patient elevates the shoulder. Instruction, raise your shoulder to your ear. Grade 2 poor. For grade 2, patient completes full ROM in gravity eliminated position. For grade 1 trace, upper trapezius fibers can be palpated but no movement. For grade 0, no movement or any contractile activity can be felt. Shoulder abduction, middle deltoid and supraspinatus. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient, short sitting with arms at side and elbows slightly flexed. Position of the therapist, stand behind the patient, hand giving assistance, is contoured over just above the elbow. Test. Patient adduct the arm to 90 degrees. Instruction to the patient, lift your arm out to the side of the shoulder level. Hold it, don't let me push it down. For grading, grade 5 normal. Hold in test position against maximum resistance. Grade 4. Holds in test position against moderate resistance. Grade 3 fair. Completes partial range of motion with no manual resistance. For grade 2, position of the patient is the same for grade 5, 4, and 3. Therapist position is also the same as for grade 5, 4, and 3, but hand is to palpate for the muscles contraction. For the test, patient attempts to adduct the arm. Instruction to the patient: try to lift your arm out to the side. Grading for grade 2, poor. Completes partial range of motion with assistance. Grade 1, trace and 0. Position of the patient, short sitting. Position of the therapist, stand behind the patient. On the side of the patient. Therapist cradle tested arm with the shoulder 90 degrees of abduction, providing support at the elbow. Test. Patient tries to maintain the arm's position at abduction. Instruction to the patient: try to hold your arm in the position. Grading for grade 1, palpable contraction, while for 0, no movement or any contraction. Shoulder extension, latissimus dorsi and teres major posterior deltoid. Grade 5 normal, grade 4 good. Position of the patient, prone with arms at the side and shoulder internally rotated. Palms up. Position of the therapist, stand at the stead side. Hand used for resistance, contoured over the posterior arm just above the elbow. Test. Patient raises the arm above the elbow. Instruction to the patient: lift your arm as high as you can. Hold it, don't let me push it down. Grading, grade 5 normal. Completes full ROM with maximum resistance. Grade 4. Completes full ROM but yields against strong resistance. For grade 3, fair, grade 2, and 1, 0. Position is the same for 5, 4, and 3. Therapist is also the same for the previous test. Test. Patient raise arm off the table. Instruction to the patient: lift your arm as high as you can. Grade 3 fair. Full ROM with no resistance. Grade 2 completes partial RM only. For grade 1 and grade 0, position of the patient is the same for the previous test. The therapist stand at tested side. Patient attempts to lift the arm on the table on request. Grading grade 1 trace, palpable contraction of muscles but no visible movement of the shoulder. As for 0, no contractile response or any movement available or visible. Shoulder external rotation for infraspinatus and teres minor muscle. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient, prone with head turned towards a tested side for comfort. Shoulder is abducted 90 degrees with arm fully supported on the table. Forearm hanging vertically over the edge of the table. A folded towel is placed under the arm for comfort. Position the therapist. Stand at tested side at level of the patient's waist. 2 fingers at one hand is used to give resistance at the wrist for grade 5 and 4. The other hand supports the elbow to provide some counter pressure at ROM. Test. Patients move upward for full RM. Instruction to the patient: raise your arm to the level of the table. Hold it, don't let me push it down. Therapist may need to demonstrate. Grading grade 5 normal. Completes full ROM against maximum resistance. Grade 4. Completes full ROM but yields to maximum resistance. Grade 3 fair. Completes full RM with no resistance. Shoulder flexion for anterior deltoid, supraspinatus, and coracobrachialis. Grade 5 normal, grade 4 good. Position of the patient, short sitting with arms at side, elbow flexed slightly. Forearms pronated. Position of the therapist, stand at tested side, hands giving resistance over the distal humerus just above the elbow. The other hand stabilizes the shoulder. Test. Patient flexes the shoulder 90 degrees. The scapula should award to abduct, upwardly rotate. Instruction to the patient. Raise your arm forward to shoulder height. Hold 8. Don't let me push it down. Grading for grade 5 normal. Holds full RM against maximum resistance. Grade 4 good. Full RM with moderate resistance only. For grade 3 fair, position of patient is the same of previous tests. Position of the therapist, stand attested side. Patient flexes above 90 degrees. Instruction to the patient, raise your arm forward at shoulder height. For grading for grade 3, complete taste range 90 degrees with no manual resistance. Grade 2 poor, 1 and 0. Position of the patient is sitting the same on your previous tests. Therapist, on tested side, palpating the muscles using his fingers. For the test, patient attempts to flex the shoulder 90 degrees. Instruction to the patient, try to raise your arm. Grading for grade 2 poor. Completes partial ROM. For grade 1, examiner feels contractile activity of the muscles but no movement. For grade 0, no movement or any contractile activity. Shoulder horizontal abduction for posterior deltoid. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient. Prone. Shoulder abducted to 90 degrees at the edge of the table with elbow flexed. Position of the therapist. Stand attested side, hand giving resistance contoured over posterior end just above the elbow. Test. Patient horizontally abduct the shoulder against maximum resistance. Instruction to the patient. Lift your elbow up towards the ceiling. Hold it, don't let me push it down. Grading grade 5 normal. Complete full RM against maximum resistance. Grade 4. Completes full RM but only holds against moderate resistance. For grade 3, completes full RM with no manual resistance. Grade 2 poor. Grade 1 trace and grade 0. Position of the patient, short sitting over end or side of the table. Position of the therapist, stand attested side, supports the forearm under the distal surface of the elbow and palpate over the posterior surface of the shoulder just superior to the axilla. Grading grade 2 poor. Move partial range of motion against gravity. Palpable contraction, no motion. As for grade 0, no control activity or motion. Shoulder horizontal adduction for pectoralis major muscles. Grade 5 normal and grade 4 good. Position of the patient supine. Shoulder abducted up to 90 degrees, elbow flexed to 90 degrees. Position of the therapist, stand attested side, shoulder to be tested. Hands used for resistance is contoured around the forearm proximal to the wrist. The other hand is used to check the activity of the pectoralis major at the upper aspect of the chest. For the test, the patient horizontally adducts the shoulder and shoulder moves full ROM. Instruction to the patient, move your arm across your chest. Hold it, don't let me push it back. For grading, grade 5 normal, completes full RM against maximum resistance. For grade 4 good, completes full RM but can only manage moderate resistance. Sometimes exhibits giving away during end range. For grade 3 fair, position of the patient, supine, shoulder at 90 degrees of abduction and elbow at 90 degrees of flexion. Position of the therapist, same as for grade 5 and 4. Test. Patient horizontally abducts the extremity across the chest in a straight pattern with no diagonal movement. For the grading, grade 3 fair. Patient completes available range of motion with no manual resistance other than the weight of the extremity. For grade 2, poor 1 and 0. Position of the patient is sitting 90 degrees flexed, and elbow is flexed to 90 degrees. Position of the therapist, stand behind the patient. Palpate pectoralis major, the anterior aspect of the chest. For the test, patient attempts to horizontally adduct the shoulder with the support of the therapist on the elbow. Instruction to the patient, try to move your arm across your chest. Grading, grade 2 poor. Patient horizontally adducts the shoulder through ROM with the weight of the arm supported by the examiner or by the table. Grade 1 trace, palpable contractile activity but no movement. Grade 0, no movement or contractile activity. Shoulder internal rotation, subscapularis, grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient, prone with head turned toward adjusted height. Shoulders abducted 90 degrees with folded towel placed under the distal arm for comfort. Position of the therapist, stand attested side test. Patient moves the arm to available ROM of internal rotation backward and upward. Instruction to the patient, move your forearm up and back. Hold it, don't let me push it down. For grading, grade 5 normal, complete full ROM against maximum resistance. As for grade 4 good, completes full ROM but yields to maximum resistance. As for grade 3 fair, completes full ROM with no manual resistance. For grade 2 poor, grade 1 and 0. Position of the patient, prone with head turned towards the attested side. Patient near the edge of the table. The entire arm hangs down freely over the edge. Hangs in neutral position, palm facing the table. Position of the therapist, stand at the stage side or seated on a long stool. Test. Patient internally rotates arm with no manual resistance, but the therapist assists or palpates muscle contraction. Test. Turn your arm. For grading, grade 2 poor, completes full ROM. For grade 1 trace, palpate contractile muscle activity with no movement. As for grade 0, no contraction or any form of movement. Elbow extension, triceps brachii, grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient, prone on table. The patient starts the test with arms in 90 degrees of abduction, and the forearm is flexed and hanging vertically over the side of the table. Position of the therapist. For the prone patient, the therapist provides support just above the elbow. The other hand is used to apply downward resistance on the dorsal surface of the wrist. Test. Bend the elbow to end of ROM or until the forearm is horizontal to the floor. Instruction to the patient. Straighten your elbow, hold it, don't let me bend it. Grading, grade 5 normal, completes available ROM and holds it from the maximum resistance. Grade 4 good, completes a full range of motion but cannot tolerate maximum resistance. Grade 3 fair, completes available range with no manual resistance. Grade 2 poor, grade 1 trace, and grade 0. Position of the patient, short sitting, the arm is abducted to 90 degrees with the shoulder in neutral position. Elbow is flexed to about 45 degrees. Entire limb is horizontal to the floor. Position of the therapist, stand at the side of the patient. Test. Patient attempts to extend the patient while therapist tries to straighten the elbow. Grade 2, poor. Completes available ROM in absence of gravity. Grade 1 trace. Examiner can feel tension of triceps tendon proximal to the olecranon. Grade 0. No evidence or any muscle activity. No visible movements.
Forearm pronation. Pronator teres and pronator quadratus. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient. Short sitting or may sit at a table, arms at side with elbow flexed 90 degrees and forearm in neutral. Position of the therapist. Standing at side of the patient. Test. Patients begin with a neutral forearm position and pronates the forearm until the palm faces downward. Therapist resists motion at the wrist in the direction of supination for grade 4 and 5. Instruction to the patient. Turn your palms down, hold it, don't let me turn it up. Keep your wrist and finger relaxed. Grading for grade 5 normal. Completes available ROM with maximum resistance. Grade 4 good. Completes available ROM with moderate resistance. Grade 3 fair. Completes available ROM with no resistance. Grade 2, poor. Position of the patient, short sitting with shoulder flexed between 45 degrees and 90 degrees and elbow flexed to 90 degrees, forearm in neutral. Position of therapist, supports the left arm by cupping the hand under the elbow. Test, patient pronates the forearm. Instructions to the patient, turn your palm facing outward away from your face. Grading, grade 2, poor, completes partial range of motion. Grade 1 trace and grade 0. Position of the patient. Short sitting. Arm is positioned as for grade 3 test. Position of the therapist. Support the forearm just distal to the elbow. The fingers of the other hand are used to palpate the pronator teres over the upper subtabular surface of the forearm on the diagonal line from the medial condyle of the humerus to the lateral border of the radius. Test. Patient attempts to pronate the forearm. Instruction to the patient. Try to turn your palms down. Grading. Grade 1 trace. Visible or palpable contractile activity with no motion of the part. Grade 0. No contractile activity or any visible motions.
Wrist extension. Extensor carpi radialis longus. Extensor carpi radialis brevis. Extensor carpi ulnaris. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient, short sitting, with elbow and forearm supported on table and forearm is in full pronation. Position of the therapist. Sit or stand diagonally in front of the patient, supports the patient's forearm under the wrist. Test. The patient extends the wrist straight up to full available ROM. No pronation of the fingers. Instruction to the patient. Bring your wrist up, hold it, don't let me push it down. For grade 3, bring your wrist up. For grading, grade 5 normal, complete full range extension against maximum resistance. For grade 4, complete full wrist extension against strong to moderate resistance. Grade 3 fair. Complete full range of motion with no resistance. For grade 2 poor, position of the patient is the same as the last tests. Position of the therapist is also the same for the last tests. Test. Patient extends the wrist. Instruction to the patient. Bend your wrist back. For grading, grade 2 poor. Complete full range of motion with gravity eliminated. For grade 1 trace and grade 0. Grade 1. Position of the patient. Hand supported by the therapist. Hand is pronated. therapist supports the patient's wrist in extension. The other hand palpates for muscle and tendon. For the test, patient attempts to extend the wrist. Instruction to the patient: try to bend your wrist back. Grading for grade 1 trace. For any given muscle, there is visible or palpable contractile activity but no wrist motion. As for 0, no movement and no contractile activity.
Thumb MP and IP extension. Extensor pollicis brevis and extensor pollicis longus. Grade 5 normal to grade 0. Position of patient: forearm in mid position and wrist in neutral. CMC and IP joint of the thumb are relaxed and in slight flexion. The MP joint of the thumb is in abduction and flexion. Position of the therapist: stabilize the first metacarpal firmly, allowing motion to occur only at the MP joint. Resistance is provided with the other hand on the dorsal surface of the proximal phalanx in the direction of flexion. This is normally strong muscle. Test. Patient extends the MP joint of the thumb while keeping the MP slightly flexed. Instruction to the patient: bring your thumb up so it points toward the ceiling. Don't move the end joint. Hold it, don't let me push it down. Grading: grade 5 normal and grade 4 good. Only B, for the experienced examiner, can accurately distinguish between grade 5 and 4. Resistance should be applied carefully and slowly because this is usually a weak muscle. Grade 3 fair. Patient moves proximal phalanx to the thumb through full range of extension with little or no resistance. Grade 2 poor. Patient moves proximal phalanx through partial range of motion. Grade 1 trace. The tendon of the flexor pollicis brevis is palpated at the base of the first metacarpal, where it lies between the tendon of the adductor pollicis and the extensor pollicis longus. Grade 0, no contractile activity or any visible motion.
Fingers abduction, dorsal interossi, grade 5 normal and grade 4 good. Position of the patient: forearm pronated, wrist in neutral, finger starts in extension and adduction. MP joint in neutral and upward hyperextension. Position of the therapist: support the wrist in neutral. The fingers on the other hand is used and give resistance at the radial side of one finger and on the ulnar side of the another finger. Test. Abduction of fingers individually tested. Instruction to the patient: spread your fingers, hold them, don't let me push them together. Grading: grade 5 normal and grade 4 good. For grade 5, tolerate maximum resistance. Grade 4 yields to maximum resistance, can only tolerate minimum to moderate resistance. For grade 3 fair, patient attempts to abduct any given fingers. Grade 2 poor and grade 1 trace and grade 0. Procedures and grading same as for higher grades. For grade 3. Fingers adduction, palmar interosseous. Grade 5 normal and grade 4 good. Position of the patient: forearm pronated, palms down, wrist in neutral and fingers extended and adducted. MP joint in neutral. Avoid any form of flexion. Position of the therapist: examiner grasp the middle phalanx of each of the adjoining fingers. Resistance is given in the direction of abduction. For each fingers, the examiner pulls the fingers apart. Each finger should be resisted. Instruction to the patient: hold your fingers together, don't let me pull it apart. Grading: grade 5 normal and grade 4 good. This muscle are notoriously weak and tends not to tolerate resistance. Distinguishing this grade depends on the therapist's experience. Grade 3 fair. Patient can't adduct the fingers toward middle finger and cannot hold against resistance. Grade 2 poor, grade 1 trace, and grade 0. Procedures is the same for 5, 4, and 3. For grade 2, position can adduct the fingers for partial ROM. For grade 1, contractile and palpable contraction can be felt. For grade 0, no form of movement can be palpable. Fingers MP extension. Extensor digitorum, extensor indicis, extensor digiti minimi. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient: forearm in pronation, wrist in neutral, MP joint and IP joint are in relaxed flexed posture. Position of the therapist: stabilize the wrist in neutral. Place index finger of the resistive hand across the dorsum of all proximal phalanges, just distal to the MP joint. Test. For the extensor digitorum, patient extends MP joint of all fingers, allowing IP joint to be in slight flexion. Test for extensor indicis. Patient extends MP joint of the index finger. Extensor digiti minimi. Patient extends the MP joint of the 5th digit. Instruction to the patient: bend your knuckles back as far as they will go. Grading: grade 5 normal. Complete activity of extension with full ROM against full maximum resistance. Grade 4 good. Complete active range of motion with moderate resistance. Grade 3 fair. Complete full ROM with no resistance. Grade 2 poor, 1 fair, and 1 0. Procedure test are the same as for grade 5, 4, and 3. The forearm is in mid position. For grading, grade 2 poor, complete range of motion. Grade 1 trace, visible tin activity but no joint motion. Grade 0, no visible movement. Fingers MP flexion, lumbricals, and interosseous. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient: short sitting or supine with forearm in supination. Wrist is maintained in neutral. The MP joint should be fully extended. All IP joint should be flexed. Position of the therapist: stabilize the metacarpal joint proximal to the MP joint. Resistance is given a palmar surface or a palmar row of the phalanges to the direction of MP extension. Test. Patient simultaneously flexes the IP joint and extends the IP joint. Fingers may be tested separately. Do not allow fingers to curl. They must remain extended. Instruction of the patient: curl your knuckles, do not let me straighten them. For the grading, grade 5 normal. Patient complete full ROM with maximum resistance. Grade 4, complete full ROM with moderate resistance only. Grade 3, complete full ROM with no resistance. Grade 2 poor, grade 1 and 0. Position of the patient in mid position. Position of the therapist, stabilize metacarpal test. Patient attempts to flex MP joint to full ROM while extending IP. Instruction to the patient, try to uncurl your fingers or bending your knuckles. Reading for grade 2 for complete partial ROM in gravity eliminated position. Grade 1 trace. Grade 1 minimal motion only. Grade 0 for no motion. Fingers IP and DIP flexion. Flexor digitorum superficialis and flexor digitorum profundus. IP test, flexor digitorum superficialis. Grade 5 normal, grade 4 good, grade 3 fair. Position of the patient, forearm supinated, wrist in neutral, fingers to be tested in slight flexion at the MP joint. Position of the therapist, holds all fingers. Index finger may not be complete, the other hand is used to resist the head of the middle phalanx of the tested finger in the direction of extension. Test. Each of the forefinger is tested separately. The patient flexes the IP joint without flexing the DIP joint. Do not allow movement of other joint. Instruction to the patient, bend your index. Hold it, don't let me straighten it. Keep your other fingers relaxed. For grading, grade 5 normal, complete maximum resistance with ROM. For grade 4, completes ROM with only moderate resistance. Grade 3 completes range of motion with no manual resistance. As for grade 2 poor, 1 and 0, the arm is in mid position to eliminate gravity. Position of therapist, same as 5, 4, and 3. For the test, patient flexes the PIP joint. Instruction of the patient, bend your middle fingers. Grading, grade 2, poor. Complete ROM with no maximum resistance. Only partial movement. For grade 1, contractile papillary can be observed for wrist flexion, flexor carpi radialis and flexor carpi ulnaris. Grade 5 normal, grade 4 good. Position of patient, short sitting, forearm supported on dorsal surface by the therapist. To start, forearm is supinated, wrist is in neutral or slightly extended position. Position of the therapist, one hand supports the patient's forearm under the wrist. For the test, patient flexes the wrist, keeping the digits intact and thumb relaxed. Instruction to the patient, bend your wrist, hold it, don't let me pull it down. Keep your fingers relaxed. Grading, grade 5 normal, completes available RM and holds against maximum resistance. For grade 4, good. Completes available RM but hold against moderate resistance and tends to give away for maximum resistance. Grade 3 fair. Position of the patient. Starting position, forearm supinated and wrist is in flexion. Same for grade 5 and 4 test. Therapist is the same for the past tests. Test. Patient flexes the wrist straight up without any presence of resistance or radial or ulnar deviation. Instruction to the patient, bend your wrist, keep it straight with your fingers relaxed. Grading, grade 3 fair. Complete available RM with no resistance. Grade 2, poor. Position of patient, short sitting with elbow supported on table, forearm in mid position, hand testing on ulnar side. Position of therapist, support patient's forearm proximal to the wrist. Test. Patient flexes the wrist with the ulnar surface, gliding across or not touching the table. Instruction to the patient, bend your wrist, keep your fingers relaxed. Grading for grade 2, poor. Completes available RM of wrist flexion without assistance of gravity. Grade 1, trace, and grade 0. Position of patient, supinated forearm on the table. Therapist supports the wrist. The index finger palpates the appropriate tendon of the muscle. Test. Patient's attempts to flex the wrist. Instruction to the patient, try to bend your wrist. Relax. Then bend it again. Grading for grade 1, trace. Presence of contractible tendon but no visible movement. As for 0, no contractile activity or any visible motion.